This job is deeper than smiles. Here's what a real day in my life as a dentist looks like. Hi everyone, welcome back to my channel DrBraces. I'm Dr. Salman Khan, orthodontist, and on this channel you always will get real honest advice, no paid sponsorship, no ad influence, direct doctor advice which I would give to my family members and friends and my patients here in my practice. So people often think I just fix things all day. It's just about drillings and fillings. But what I would want to tell you is it's not just about the drillings and fillings, it's much more. It's about people, their stories, their life transformations, and most importantly, confident smiles. So I am a diamond Invisalign provider, which is also coincidentally Bengaluru and Karnataka's largest Invisalign provider, and we transform smiles each and every single day. And most importantly, I don't just transform smiles, I really build life-changing confidence in my patients' lives. So today I want you to take you guys behind my clinic's doors and show you actually in real time what happens in the day of life of an orthodontist. It's not always rosy. There's a lot of operations involved. There's a lot of meaningful things that we do here. We smile when our patients smile. We are sad when our patients sad. And when our team does something remarkable, we achieve. We stand by our team in their difficult times. And most importantly, I would say the joy and satisfaction of going home to bed after a day of fixing things for our patients and for my team really makes me feel that I'm doing something meaningful with my life. So most people think we dentists, we are just busy fixing cavities, doing root canals, and always judging patients and telling them how to brush better. But let me tell you, I spend more time listening to patients, observing their concerns and planning the treatments than the actual treatment that happens on them. So at DrBraces, whether it's an Invisalign patient, a braces patient, a small 6-year-old kid, or an elderly patient who's 80 years old, all of them receive the same care and the same concerns are always addressed in a different way to suit their needs. So at the end of my consult, the patients always tell, I wish I understood this sooner. It's not about just doing the treatment, it's about changing their perspective, making them more self-aware of all the dental problems they have had and how they could have easily prevented it, and of course how in future making sure that these dental problems can be kept at bay easily in a preventive fashion rather than coming for treatment again and again. So every day I meet someone nervous for the first time they have come for a cleaning, or someone who's here in the office because their wisdom teeth hurts and they want to get their wisdom teeth out, and they're hiding their tears, they're fighting hard to not cry in front of us when that injection is given. Sometimes you also come across a parent who is concerned and actually the parent is silently weeping when the child is undergoing treatment for something that is painful. Sometimes I come through some divorcees and they are here, they want to start a new life, they want to do a full smile makeover transformation, but it's not just the change in the way their teeth look, but it's more about their self-confidence. So sometimes I also come across people who walk into my office and tell me, doctor, because of the way I look and because of the way my teeth are, I'm unable to find an alliance or a partner and settle down in life. So it's more about, keeping in mind the needs of the specific patient. Sometimes the deadlines are short. I have a pressure of finishing a smile in 6 months. Sometimes we have a long span, they say, doctor, 2 years. Sometimes the international students are leaving away in just 3 months. Sometimes we have overseas patients, NRI family, they just come down, they're here for a month, they want to finish everything and then go back. So different patients, different perspectives. On an average over a year, we see anywhere roughly between about 3,000 to 4,000 patients. And all these are not just numbers, they are actual real people with their real stories, real struggles, different backgrounds. And that's what makes a dental job very unique and very, very meaningful. Having said that, dentistry is really precise work. It's a serious job. Every millimeter counts. Every treatment plan, whether it is on 3D, whether it is Invisalign, whether it is manual treatment planning on braces, or we are doing a digital smile designing on veneers, crowns, or a simple scaling. Everything requires thoughtful attention, approach, and a meaningful resolve so that these problems do not recur again and again. So it's like building a treatment plan in 3D, not just treating the outcomes which are coming to us and not just reacting to the situations, but making sure we are in control of the situation and we are preventing this to happen again and again. Don't forget to like, subscribe, and share this video if this video has given you new perspective to dentistry. And if you want to ask me any question personally about dentistry, about how a life of a dentist is, please key in that question in the comments and I'll reply to it personally. So one thing I tell all my patients is the best treatment in dentistry is the treatment that you actually prevented by doing preventive care. So the best treatment is not always exhaustive. Every time, every day, every year we treat thousands of small kids, young teenagers, adolescents, young adults, and even older patients. And the best outcomes are always the ones that are minimal treatment, maximum confidence, preventive dentistry, and making sure we caught all these problems early and we prevented them right in the beginning. So one of the most common things I hear, but doctor, I don't have pain, so let me not look at that treatment right away that you're recommending. Probably sometime later, 6 months down the line or a year down the line, I'll look at it and I'll get it done. So that's what I always tell my patients, that this pain is the last symptom that comes in dentistry. First you will have all the decay and all the nerve degeneration and all that, and once the pain comes, that means when you come to us with the pain, you have come at an advanced stage of dental disease, and usually the treatment that follows after the pain is more aggressive than conservative. So after years in clinical practice, 16 years to be precise, and this is my 17th year, I've learned that patients don't require judgment, they require more compassion. Patients require a little bit of forgiving for all the simple mistakes that they have kept on doing. They require more approach and understanding of their fears, and constantly they require their myths to be cleared again and again. And one common thing it brings me to, the patients always tell that, okay, I don't have pain, so let me not do treatment for now. So this, I really want to clear this misconception once and for all. Very often I hear a sentence, even in family get-togethers, even in weddings, see, I have a cavity, but it doesn't hurt, so I don't think it's a problem. This is something very, very trivial, that you must know that not all cavities hurt, but all cavities require attention and treatment as soon as possible, even if they don't hurt. So precisely in my next video, I will explain you what happens if there is a cavity which is not hurting, but you have left it untreated for a long time, how the small silent decay starts and then it snowballs and compounds into something which requires more aggressive treatment. So I hope to see you in the next video. Until then, keep smiling. Bye bye.